Collaborative monthly meeting for March 5th, and we are recording this session. So welcome, everybody. It is nice to be back with you. Mary Pat Gallus, the Collaborative Chair, is on vacation today, and she is attempting to fly north into the storm. So we will send her good thoughts and hope that her flight is on time. I want to just start with going through and doing introductions of who all is on the line. And if you would just, let me see, I'll call you out, and then if you can just let people know who's with you in your office and what agency you're with, that would be really helpful. So Greg, I see you are first on the list.
Yay! This is Greg Smith with the state.
Congratulations, Greg. Greg, tell them where you're from, and is there anybody in the office with you?
I'm calling from the state, Department of Human Services, and no, there's nobody in the office with me. Okay. I didn't know if maybe Connie was with you. Well, no, she's not, and
okay.
I think she's running a little late, but I'm sure she'll join us shortly.
Okay, great. Okay, thanks, Greg. And let me see. Next is Holly Darby.
Hi, it's Holly, and Whitney is with me, and we're from the Wells County Area Agency on Aging.
Good morning to both of you.
Morning.
Katie?
Yeah, this is Katie Mortensen with Healthcare Policy and Financing, and it's just me today.
Welcome, Katie. Julie?
Hi, this is Julie. I'm with University of Colorado Health North, and there's nobody with me.
Okay. Thank you for joining us. And I see Kelly is on the phone.
Hi, this is Kelly McCracken from the Colorado Department of Public Health and Environment, and it's just me today.
Hi, Kelly. And Sam. Samantha.
Yeah, Sam Decker with Tri-County Health Department, and it's just me today.
Okay. Hi, Sam. And Sue Connery.
Hi, it's Sue, Hilltop Community Resources, and it's also just me.
Ah, okay. And there is a new person at the Mesa County IPA who is not yet on the phone, and her name is Kelly Jackson, correct?
Yep. Yes,
okay.
Yes. And I'm not sure she was going to make it today.
Okay, great. Well, we have a Kelly Jackson on our staff, too. They spell Kelly differently, but we were very confused at first. But it's, I guess there is more than one Kelly Jackson in the world, so
okay.
We'll just have two of them involved in the collaborative. That's kind of nice. Is there anybody we didn't get to? Okay, great. Well, we will go ahead and start our agenda. I know that some of what we have on the agenda are some items Connie's going to do, and I know we have a guest coming as well. So I will go through the pieces we can, and then we'll loop back. So just a reminder, as usual, we just want to talk about what the agenda is for today. So we'll do some brief collaborative updates, and then I'll check in with Kelly. And then we will see about some statewide training updates, centralized referral system. Mary Pat does still have some future agenda items, and the agenda today was just fairly full, and so we didn't have time to put them on there, but she's keeping a list. So we have HIPAA compliance issues that someone brought up, and also participant retention. So those are the two things that are coming up, but if there's also other stuff, please let her know. As you know, if you go to selfmanagementcolorado.org, you can not only see all the classes that are being offered across the state, and these are the self-management series classes, but you can also now see all the trainings that are available. We did change the website so that you can look for them by the same groupings as we used for the classes. So you can look for CDSMP trainings, CSMP trainings. And then within the detailed information, it tells you what the program is called by the people who are doing the training. So we did make that change to the database, and that is all set to go. So Kelly, can I ask you if there's any updates on data, anything we need to know about?
Sure. And can you hear me okay?
Absolutely.
Great. Thank you so much for allowing me some time on the call. I want to thank everyone for their patience around this correction that we're making to the host sites and license holders in the NCOA database. We did receive corrections from COA, so thank you so much. And if anyone else has any other license holders, if I can ask you to please read through the Excel spreadsheet that Mary Pat sent out and send back any corrections you have. I think we made the deadline, what did we make the deadline? The 20th, I believe, of March. So you have a couple weeks. And really this deadline is a deadline just for deadline's sake, you know, just so we kind of keep on track and get this done. So please read through it and let us know if you have any corrections, and then Lori will make that in the database, and we'll be making sure we have our eyes on that and checking it moving forward. And then also I wanted to just urge everyone to please, if possible, get the Medicaid number from participants. If they're Medicaid participants who are going through your CDSMP classes, there is a space for that on the participant information sheet. And if people are filling that out, we're keeping that in a secure location for the possibility, and it sounds like maybe that possibility could become a reality, that HCPF will be doing an analysis on claims based on the participants who are Medicaid members who've attended CDSMP or DSMP classes to see if that made a difference in their cost to the system. So I wanted to ask license holders or anyone on the phone if there has been an issue in getting these Medicaid numbers, if there's anything that you need from us, for example, like a script for your lay leaders when asking participants for Medicaid numbers. Has there been any pushback?
Kelly, I would think we haven't, as far as I know, we haven't had any real direct pushback on that particular question at this time. What we see is a general, we have to do a general explanation of, you know, the data becomes de-identified, nobody's going to have your name and phone number, you know, those kind of things. But I don't think we've had anything that's been real specific around that number.
Okay. Okay. Anyone else?
Kelly, this is Connie. Just to kind of, underscore what Kelly was just saying. This isn't 100% definite, but I did put into our carryover funding request some funding to support that effort through HCPF, and I don't know if Katie Mortensen is on the line.
Yeah.
Yes, she is.
Hey, Katie. So we've been talking about that, and that seems like, unless Katie knows something different, hopefully not. But
no,
that's a possibility.
As long as the numbers, and we've kind of talked about preliminary numbers, previously when we'd looked at doing kind of a dive on this data, we only had a handful of Medicaid ID numbers, and so it wasn't going to be worth an analyst's time, nor was it going to tell us very much, but it seems like we've gotten a lot more Medicaid IDs, so that should be possible.
Yeah.
Great. And then I was going to say, Katie and Connie, just let us know, you know, when you need to receive that list from Lori, or maybe you've already reached out directly to her for that, but, you know, she is keeping that, so.
Okay, great. Thank you.
Yeah, great. I had one from a little bit ago, like a month or so ago. But yeah, but as Kelly was asking, if there's, I know when we've had to do similar things, like when ACL wanted us to get permission from people to use their information for what they wanted to do with some kind of outcome study. You know, we had a whole script for leaders to use, and Kelly and I could work on something like that if you think that would be helpful. I know from working at Medicaid, sometimes people were hesitant to give their number because they thought, or, you know, identify themselves, they thought it might affect their benefits or privacy or whatever. So do any of you feel like we need to do something like that to assure people and let them know, you know, the positive benefit of getting their ID numbers may be that we are able to demonstrate some positive outcomes, which would help other people with having classes available in the future. Do you think anything like that is necessary, or should we just try to encourage it and see if it becomes an obstacle, like maybe try to get some feedback by next month? And if it's a problem, we could write up a script or some, something to reassure people. What do you all think? I know you're there.
They're being very quiet, aren't they, Connie?
Yeah, any opinions either way? Is that something you would all be able to do then, is to encourage your leaders to ask for that and let the participants know why it would be helpful? Or?
This is Sue, and I would say let's give it a month and encourage our leaders to just ask for it and see what kind of pushback. It hasn't been at the top of my conversations with leaders, so my preference would be, rather than creating another form to fill out or another thing that they have to, not a form, but another something they have to read, let's just make sure that they're prepared to answer the questions if there's pushback.
That sounds good. Thank you, Kelly.
Anybody else have anything around the script or around the Medicaid number they want to share?
This is Holly from Weld County, and we probably would not really want another script as well. I think as leaders are building the rapport with participants at the beginning of class, and if they're explaining, the importance of it, and, whether you read it or just say it conversationally in a casual way, people aren't going to give it. I mean, I don't think a script is going to make them change their mind. So that's just my 2 cents.
Thank you. Anything else? Any other questions about data? Yeah, I'm sorry, I sound like I interrupted someone. Is there another comment about the script or about Medicaid?
It's Connie again. I was just going to, I appreciate the comments about not having another script, another piece of paper to follow instructions. If you could just encourage them when they're asking for that to let them know it could help get funding for additional classes for more people in the future. That is the bottom line of why we're doing this. And, I think if people realize that there's a positive, potentially positive outcome for it, they might be more apt to provide that.
Kelly, on just another data topic, are you all getting what you need from us in a timely fashion? And I mean us, meaning all the license holders.
Yes, I think so. I mean, I check in with Lori each month, and we have another staff member doing the quality assurance checks, and I've had no comments or concerns about the receiving data. In some ways, I almost feel like that might be a better question for Lindsay Blackwelder, because the submission needs to come in before license holders can be paid, and so as long as that whole process is working smoothly and people are feeling satisfied with their timing and getting paid and all of that, then I would say it's working well.
Great, thank you. I do have got an email from Lindsay, who wasn't able to be on the call today, and she didn't make mention of any issues around that at all. I know we're going to be talking about Year 3 grant, and what she did want me to let everybody know is that there will be more paperwork coming your way regarding the rollover from Year 2 funding, but that was the only information I had on that data piece from her. So we will assume all is well. So anything else, Kelly?
No, I don't have anything else. Anyone have any questions for me? I guess the only other thing I would say or preface is that, I think there's some conversations that we probably need to have as a group as we move closer to the end of this grant. I know there could be some possibilities of rollover and that kind of thing, so the hard stop will probably not be end of August of 2015, but I do want to start everyone thinking about what the state's role could be in terms of continuing to collect data for these classes, and if that's a desired role that people see for CDPHE. I've started some of these conversations internally, and I'm sure we'll also be having them with State Unit on Aging, but I also collaborative to be thinking about and what could be the value of continuing to do that. So I just wanted to put that out there and you know, get people thinking about that.
Great. I'm really glad that's a possibility. I didn't know whether it was going to be a funding issue or dependent on, you know, additional grant funding, or but I'm glad we're having the conversation.
Sounds good. So again, I don't think there's anything we need to, you know, no decisions or anything like that. It just start thinking about it. Start thinking about what the value could be. Great.
Well, thank you, Kelly. Next on our agenda is Connie had, I don't know, is Lily online with you?
I just saw her email. She said I just sent her the meeting information. I thought I had sent that to her before, so she hopefully will be joining here shortly if she's still on her email.
Well, why don't we go to the next agenda item and then come back. And the next agenda item is Connie and Lindsay Blackwell. They're talking about the third year of the grant and carryover funding from year 2. So Connie, I will turn it over to you.
Well, thank you, Lindsay. I did submit the carryover funding budget request and got an email yesterday from the budget officer in DC that I need to redo some things. So apparently our calculation of what we had left to spend is a little bit off of what they had, and so it's not a huge discrepancy, but I need to trim some things here and there to make that fit. So it's in the works, but not imminent.
Okay. Well, and then as I understand it, once it gets approved from the federal folks, it comes then back to State Unit, and then there's internal things that happen, which can take some time, like 4 to 6 weeks. And then Lindsay will get to go ahead and be able to issue the paperwork.
Yes.
Okay.
Yes, and it's the exact same process that we had last fall with the what are called option letters, which are basically contract extensions with AHEC and with COA. The one with AHEC drives all of the subcontracts or MOUs with all of the license holders, and that did take a full 6 weeks last fall. Todd Coffey has tried to give some feedback about that to people in the process, to just to show the impact of what those delays have, and so I'm hopeful that it'll go a little bit quicker this time, but certainly can't guarantee that.
And just to quote Lindsay Blackwelder, and maybe you all already know this, but just to reiterate, until you have that letter from her that indicates the date that the carryover funding is approved and available for your use, don't think you will get paid for those folks. It happens if you are submitting the paperwork before the date of that agreement from Lindsay, because it will, as we found last year, if you have people that are in classes, that's terrific, but you can't submit them for reimbursement until you have the date of the agreement. So for those of you who have some flexibility, and when you do your classes, you might want to hold off on them, or just don't count on receiving any more reimbursement for those classes until that paper is, with the date on it, is in your hands. Because you don't want to assume you're going to get it and not get it.
That's all I have on that item.
Okay.
Unless anybody has any questions.
And how about the bulk ordering piece?
Well, I was really happy about this. You know, several people mentioned or have mentioned in other meetings and at our in-person meeting that the materials are expensive, and if there was any way to save some money on those, that would be welcome. So I was really pleased with working with the person at Bull Publishing, which, as you probably all of you probably know, is the company that produces the materials. And I did spell that out in an email, but basically, if you all can decide what all you need for, you know, the next 6 months or whatever period of time that you're comfortable with paying for up front, and then you can give those orders to me, then I can work with Bull to figure out exactly how much it's going to cost. And then what she said is she needs one billing address, which doesn't really impact anybody, but we can be the billing address for that. But once you know how much it's going to cost, if each license holder can send a check to Bull Publishing, when they get everyone's checks, then they'd place the order, and then they'd be shipped out to each individual organization. And so that is exactly what people have asked for, and it would, depending on how many materials people wanted to order, could represent a pretty healthy savings. So I haven't heard back from anyone, though, so I was kind of surprised about that. And I don't know if you're just thinking about it or what. So give me some feedback on that.
I know we probably have our ordering done to get us through the grant period. So at this point, we don't need to order additional materials just because we had already ordered them. But it may be, I don't know, Connie, but maybe some of the others have already got their materials. Holly, you're online.
And you know,
you already have your books in place, or?
We have a pretty good supply, but we'll probably be sending you just a small order, Connie, in the next day or so. We're just a little behind on our to-do list, so we'll get it to you here soon.
Yeah, there's no rush as far as when I need to do it. It just, you know, kind of it depends on, you know, everybody else, and maybe I could set a deadline for it so that we would know when we could move forward and get actual prices. I suggested through the end of the grant, but there's no reason, you know, if you have a pretty good fix on how many that you definitely know you'll need in the next whatever period of time, you know, year, if you wanted to go that far out, you know, we can still do the same thing. It's not tied to grant funding, so I just use that date because, you know, that's sort of a target potential end date for the grant. But would anybody, was that Holly that was just talking?
Yes.
Yeah. Is there anyone else that would thinks that you'd want to order some in the next 6 months, or if it were 12 months, would that make a difference?
Hi, Connie. This is Glenda Mitchell, and I just want to let you know, we've ordered out for our whole year. We did that order right when we came into our grant year, so that's why we won't be needing anything for a good while. And we've been getting a pretty good discount from them. Meredith and I have been talking back and forth, and our discount that we've been getting was pretty good.
Yeah, that's good. Yeah, it does help to order a lot at once.
Yeah.
Hi, Connie. This is Sue, and we're good for this year. But I'm basically looking at what's going to happen next year. So I may need to. I may have an order for you. I'm hoping to figure that out by probably the middle of this month, actually.
Okay.
Okay.
Well, maybe I could send out an email saying let me know by the end of the month.
Yeah, deadline.
Yeah, I know. people tend to, self-included, not get things done unless there is one. So, but I didn't want to postpone it too long if somebody was needing to order right away. So, is there anybody who needs some for classes that are starting in the next couple weeks by any chance?
No.
Okay, doesn't sound like it. You know, and it's not something that would have to end if the grant ends in August. It doesn't mean that you couldn't still do this. You just have to, you know, pull your ideas and resources together and have one of the license holders place the order, but then they wouldn't be out any money up front except for the materials that they wanted to order. It's just since we have the grant now and I'm in the position of being able to do that, I wanted to offer that. So anyway, though, even now or in the future, it is a possibility of saving some more money for those materials. So I will send out an email about that and ask for feedback by March 31st.
Great. Thanks. It does make a difference. We have found ordering in bulk that way really does save some money. So thank you. And then
Sure.
I think that Lily is on the phone, but since we're on your agenda item, do you want to go ahead and catch us up on the sustainability plan?
Sure, that won't take too long. I did get a draft of the plan from Wendy, and so I'm going through that, and then we'll need to get it finalized. And then what I wanted to do, what I asked her if she could do, is we could schedule a conference call to kind of go over that and see what questions you all might have and what issues, you know, kind of what comes next, because the document, as you know, is a document, and so we need to decide what we how we want to approach things, and I think it would help kind of kick off that process and in a way wrap up her involvement by having that kind of a conference call. So I'll be once we get that finalized, then I'll send out a poll and try to get a date that would work for the largest number of people. And they should be able to record that so that if you can't join in, we could still make that available. So that's where that is.
Great, thank you. I did get a call from Meredith from Telegen this morning, and she is on her way to a meeting in Pueblo, so isn't able to join us. But she is, she, like Katie, comes to our collaborative with real connections to funding organizations and implementation organizations as well. So she is hoping to be able to participate in that discussion piece around the sustainability plan. So when you have the opportunity to reach out about that, if we could include Meredith on that, that would be terrific.
Okay, yes, thank you.
Sure.
I'll make a note to do that.
Okay, well, I am going to go backwards now. We're going to see if I can go backwards in my, there we go. I got it. I actually went backwards. So, Connie, I know that Lily is on the line with us, and I will let you introduce her, if that's okay.
Sure. Lily is, she can tell you more about her organization, but I did send out an email to give you some ideas about what HealthLinks does and their connections. I was, in terms of how I came to get in touch with Lily was by looking at employer associations and trying to see, okay, how could we consider getting funding for CDSMP through employers, through health and wellness programs, and made the connection with her, also with the help of Kelly McCracken and others at CDPHE who have a relationship with them. They are part of, and Lily, looking for my email here real quick, but part of the University of Colorado School of Public Health, is that correct?
Yep, that's correct.
And great. And Lily's been really helpful in looking at, you know, what options we might have for letting the employers that they work with know about CDSMP and DSMP as resources for their employees through their employee wellness programs. And HealthLinks provides consultation to employers on how to become certified through her organization, which is kind of a credential that reflects that they've got positive employee wellness programs, that they're trying to support their employees in these ways, and it's an extra, added benefit. So I'm just excited about the possibility of doing some things with HealthLinks. Lily, did you want to share a little bit more information, a little more detail before we open it up for questions?
Yeah, that's great, Connie. Thank you so much for having me, and I see, Kelly on here, who has been so supportive and since 2 years ago when we launched the program. Connie, I don't know, is there a way for you to share my screen? I do have a couple of slides, if that possible.
That would be a question for Lindsay. Is that, or
yeah, let me see if I can do that for you.
Are they online? We could direct people to your website, or
yeah, I just have them pulled up on my screen. Okay. And if you go to my name in GoToMeeting, there should be an option for you to make me one of the presenters or share my screen.
Okay, I am trying to get there. Hang on here.
No problem, Lindsay. Thanks. I'll just start by giving you a little bit of background on our program. So as Connie mentioned, we're a program based at the School of Public Health in the Center for Worker Health and Environment. So our offices are out here in Anschutz Medical Campus, and we do research, education and training, and public health practice programs all around improving the health and safety of workplaces. So we launched HealthLinks 2 years ago, and there are 3 main components that we're really focused on. The overall goal is to engage employers, and we have, oh great, there we go.
I think we got it, okay.
Okay, can you see my screen?
Cool, yes.
Yeah, we're seeing part of your screen and then some of the backup on your computer. There you go.
Okay. I know. I thought you get to see like my whole life in front of me.
Very well,
so the way that we developed this framework, which is an online assessment to have employers go through an application for Healthy Business Certification. We had the LEED certification for green building in mind when we developed this, and we used an evidence-based framework from CDC and World Health Organization that has been tested for what can work across any industry and any size business. So we are focused on small business in Colorado. And the way that we work with them is to provide free on-site advising, and this is delivered by community advisors. So we've done 8 trainings around the state and have trained over 150 community advisors. Some of them are more ambassadors than advisors, but we do have community advisors appointed in 18 counties across the state, and they help businesses come up with healthy business action plans in order to get certified, but the whole goal is for them to become aware, educated, and start to implement a lot of policies and practices for prevention. So it might be them holding a lunch and learn, or subsidizing a group of employees to go through the or enroll and complete the diabetes prevention program, or take your classes. So the other piece is that we educate them. We do a lot of education around what the benefits are to worksite wellness programs, and so this is a place where we can deliver some of the information that you've and Connie shared with me, your fact sheets about chronic disease management and prevention, and how it can can not only improve health outcomes, but it can improve things like productivity, employee retention, and recruitment. And so on the back end, what we're doing is we're looking at how these programs actually impact some of these major outcomes. And that's more on the research side of things that we're doing. So we talk to employers about not just the financial gains that are potential financial gains around worksite wellness, but things like creating a culture of health, and we have a lot of community partners in public health agencies and also in health and wellness coalitions and economic development groups. And so we're having those folks help us recruit businesses and do outreach to businesses, and then serve as a platform for these employers to get together and talk about ideas and things that they're doing in the community. So this gives you a snapshot of what the 8 benchmarks that we focus on, and we look at things like what the company is doing in terms of leadership commitment, what resources they're dedicating, and this is where I think there's an opportunity for us to really highlight some of the resources that you're providing. So if we're working with businesses and we know that there's going to be a class held, we want to make sure that we're plugging them in and sending them an announcement about those classes so that they know they're going on. And then we also work with them to we do a little bit of matchmaking. So if there are businesses that they're too small to do anything on their own, we also help match them up with businesses, their neighbors, so that they can really leverage resources. So this just shows you where we focus in terms of wellness. We cut across social, physical, mental, emotional, and financial. And this is our focus on prevention. So we're assessing what they're doing across all of these areas, and whether it's in how they're delivering this sort of information to employees, whether it's organized activities, education, incentives to participate in or meet certain health benchmarks or outcomes around any of these. And so we have right now 160 businesses, and we could go and tell you how many of them are really focused on disease prevention and management, and I think that might be a good place for us to start. So this is our website, and I know Connie sent out a link to it, but feel free to go in and search what businesses are currently certified. We have this advising section, which is a place for companies that aren't quite ready for certification but want to get started. And in 11 counties, we also provide seed funding. So depending on the size of the business, we provide $250 to $1,000 to businesses under 50 employees, and they can use that at their discretion, but we really help guide them based on what their most what their priorities are. And so I want to make sure that we show you what counties have that seed funding available. And then the Resource Center is where we plug in vendors and local resources. So this is where we would want your classes listed, and it's also the place that connects businesses. So we have on the back end, as they're going through the application for certification, it pulls in any resources based on their zip code. So it kind of auto feeds them and pushes information to them based on where they're located. So I think I'll stop there and just based on time and see if you have any questions. But Connie and I have talked a lot about what we can do to promote the classes and also your programs, but we're open to any ideas you have on how we can work together.
And maybe I want to let other people ask questions, but if I could add a little bit more, a couple other comments I thought about. One of the classes that we also talked about, Lily and I talked about, was the Spanish-speaking, Spanish language classes, because some of the folks that might be in higher risk, you know, worker, laborer types of environments might be more at risk of injuries and that kind of thing. And anyway, the Tomando classes would be also something that that HealthLinks could talk to employers about in their menu of options for under CDSMP.
And yeah, I'm glad you mentioned that, because that's something we have, like an ongoing needs assessment both through the application but also through the coalitions that we're working with, and we keep hearing it. It keeps coming up that from our employers that they would love a resource for Spanish-speaking education around disease management and prevention.
Okay, and some of this would be, I mean, most employees are under 60, so some of this won't apply to the license holders that serve only older adults, but of course lots of people are still in the workforce well beyond 60, so we don't want to exclude that population or assume that it should be excluded. But organizations that serve all ages, you know, might be more interested. And just as a reminder to those license holders that are on the phone for grant purposes, you know, if you were on the call a few months back, I mentioned that I had been informed by our grant person in DC that while the priority for spending grant funds is 60 and over with a chronic condition and 18 and over with a disability, we can also use grant funding for 18 and over with a chronic condition. So in essence, 18 and over for both, for either chronic condition and or disability. So to that end, then anyone who can serve a younger population can tap into grant funds if you have the MOU with AHAC to do that while we have grant funds. And I had thought and talked with Lily a little bit about if we were able to provide some classes to some of those employers that were grant funded now, that might be serve as sort of a pilot project for them to kind of test the waters and see if that's something they would want to try to fund in the future.
Mm-hmm.
And some of the people on the line have some other funding that, you know, some folks have some pretty significant foundation funding that may fund those classes, you know, now and perhaps in the future. So it may just create a greater pool of potential participants. So that's what I wanted to mention at this point. So comments or questions from others?
Lily, this is Lindsay, and I have a question, a couple of questions actually. I know you're working real closely with Kelly and with the Diabetes Prevention Program, and I'm not sure how the interaction with the employer happens. Would it be the kind of thing that if you were working with an employer group or an employer, you would have us just provide you with information, or would you want us to go in with you to talk to the employer, or would you contact us if the employer has interest? I mean, how would that workflow-wise work?
Yeah, good question. So currently what we're doing is we're having our advisors go in. The advisors are provided with a summary report, so they know going in what the business is already doing, and then they also have come up with these strategic goals and that serve as like discussion points. So they're going in with information around the DPP program, if there's a available program, and also if we know what covered benefits the company has. So if they do have the ability to have it covered, we have that as one of the items that's highlighted. But that being said, I think that we're open to having businesses that would be good fits, know it based on their application, having one of the license holders come in with us as part of that advising session. And those license holders might also be interested, you might also be interested in being advisors. So we've trained the ACS Cancer Community Care Coordinators, and we have an arrangement with them where they have advising sessions, and then they go back and they have education sessions or lunch and learns as follow-up meetings to the employers. And so right now the handoff is that we come back to you and we make an introduction, and we also provide your materials. But if there's a case for us to go in together, we're open to that. We can do that.
It sounds a lot like, Lily, the work that COA has had, and some of the other license holders too have had in working with coaches within medical practices that are going through patient-centered medical home transformation, that there's a group that goes in and sort of shares the information, and then it may be an opportunity for us to go in and talk about the classes and the other parts of our work. So, that's
has that worked well?
I'm sorry?
Has that worked well?
Oh, absolutely.
Okay.
Totally well. Yeah. And it works well from both perspectives. From their perspective, I think it works real well because they're not getting inundated with too much information. They're just getting the information they want, and then we can provide details down the road. So that feels real comfortable.
That's great, and we're happy. It's worked really well with our providers to do those handoffs, and I think it's been a nice way to keep the businesses engaged, is to have this network of providers that check in with them, and we're very, we're very transparent about it, and we of course ask permission before making those introductions, but they are very willing and receptive to any information or any help they can get.
Great. Are you finding that there is a particular area where you're seeing the majority of the employers are, or is it kind of spread out throughout the state? The reason I'm asking is I'm just wondering for the license holders what areas might be.
Yeah, good question. We have, it's really, right now we have the majority of the businesses in Pueblo, around Pueblo, really split between Pueblo, Denver Metro, Tri-County, because this is where we have the strongest community relationships, and and the public health agencies have worksite wellness coordinators. So Tri-County has been really effective, and also down in Castle Rock. The Northwest region through Summit County, Eagle County, Jackson, and Garfield is also active, and they just received more grant funding starting in July to work with us to actually expand health links. And then over in Montrose, Olathe, the Western Slope, we have a lot of businesses that are engaging, and we also are working with their Live Well community coordinator, who's our lead advisor. So there's there's folks, and then we just did our first training down in La Junta, and Rick Ritter, the director of their health department for Otero County, is going to be supporting 8 more worksite wellness trainings. And so great opportunity if you have folks down in that region for us to include information in our upcoming trainings for employers. And then same with La Junta down in Durango. We did a training on Monday, so we're going to start to see folks and businesses apply for certification from down there.
Wonderful. So you just hit about every one of our license holders.
Oh, good. Yeah, I think the gap we have is that we're working on is up north in Weld and Larimer, and we have one partner, Nancy Littleford, who's working on helping us engage with some companies in some high-risk industries, and actually in oil and gas, who are this is very new to them, but I'm guessing that they would have some folks that would really need your classes.
This is Kelly, and I just want to kind of go back a little bit to the advisors. When Lily was explaining about their role in outreaching and talking to employers, and one of the things that I did was do a presentation for the advisors on the diabetes prevention program, and then give them some tools like just kind of a not a blank presentation, but a kind of a Swiss cheese presentation that they could use as well if they wanted to present to employers, as well as some materials that have information about the diabetes prevention program. So I thought that was a great way to start to spread the word about that evidence-based program through their advisor network. So I just wanted to reiterate that felt like a great partnership.
Thanks, Kelly. I think that brings up a good starting point. Would be we do monthly advisor calls, and so it would be great to have a presentation on the chronic disease self-management program for our advisors, and have you present to them on that.
That'd be great.
Mm-hmm. Yeah, that sounds like a great idea. And although this call is specific to chronic disease self-management programs, ones that come under the purview of Stanford University, I know here at the State Unit on Aging and in some of the organizations that are on the line, there's been a desire expressed to market kind of a package of evidence-based programs rather than like one at a time. So I don't know if that might be something that would be worth looking into, like, one that's, and I'm not an expert on this, but a matter of balance to teach people how to, especially for older adults, obviously, balance becomes an issue when strength is waning and vision may be waning and all that, but I'm wondering if that same kind of curriculum might be applicable to younger workers as well. So that might be something we could pursue as well, if you'd be interested.
Oh, I think that's a great idea.
Okay.
Yeah. So I'm going to have to jump off here in about at 10 o'clock, but for next, I think you have my information here, and anyone can feel free to email me, but for next steps, it sounds like if we could get a presentation, and Connie, would that be you who would give a presentation to our advisors?
Possibly. We could, and maybe with one of the license holders or someone that does classes or something like that. Do you have a date for that in mind?
I don't off the top of my head, but what I'll do is I'm going to have, I'll follow up, and I'm going to introduce you to our advisor and outreach coordinator who just started last week. His name's Greg Schwitz-Gable. And so we'll have him look at what our next calls, what's on the agenda for our next call, and figure out a good date for that.
Okay, that sounds great.
Great.
That's a good way to get a new person real busy.
I know. We started. The second day was driving to La Junta, so we went right in the deep end.
Good for him.
Yeah. Well, we're really excited to be engaged with you guys, and any way that we can help promote any new materials that you have through our website and also through our communications. We do a monthly newsletter that goes out to all of the businesses, and we also do monthly webinars, and that might be another forum for you to present to, and that's employer-facing and not advisor-facing. We are here to help spread the word.
Great. Any other questions for Lily? Well, thank you, Lily. This has been great information.
Yes, thank you very much, Lily. Really appreciate it.
Have a great day.
Thank you. You too. Bye-bye.
Now we're going to see if I can switch it back to me. Yay. Okay. That was great. Thank you. Okay. Getting back, hopefully you are now seeing our slides again for the collaborative. And if you're not, let me know. And you should be seeing my screen.
I'm just seeing you as the organizer and the call-in information.
Well, okay.
That's all I'm seeing.
There we go. How's that?
Mine hasn't changed.
Oh, okay. Well,
it says, mine at the top says waiting to view Lindsay McIntosh's screen.
Okay. See if I can
maybe
get
it's coming.
How about now?
Yes.
Now it's back.
Yay. All right, we got it then. Hallelujah. All right. So, Connie, you had wanted to talk about the survey data. And just as we have a half hour left, so everybody knows.
Oh, wow. Yes. There, I had quite a few. We had talked about, we've talked about several times that it would be very helpful to have outcome data in Colorado on the programs, and Susan Milligan is one example of that outcome data, and hers was very positive and is an example we could use to say, hey, or University of Colorado North did the same surveys that Stanford does and got similar results, and in some cases even better results on those surveys. There was also a survey and it was, I guess, exclusively with COA participants between February 2007 and January 2010. And I sent out to everybody the full...
We were the only license holder. And so the Kaiser data was reported through us as well.
Okay. Sorry. So you covered the whole state, and there were all the other license holders on the phone were not involved at that point?
No, they didn't have all of the data was reported through COA.
Okay, so I sent out the full report and then the kind of the nutshell version. The nutshell version started with the word outcomes, I think, and if you all have access to that, it's just a few pages, but. The survey is not, I thought it was the same survey as Stanford, but it's not. They did incorporate two sections that in one case was identical and another that was really close, and they're the same kind of sections of data that Stanford reports about the person expressing, how confident they are in managing a variety of symptoms related to their condition, fatigue, such as fatigue, emotional distress, need to see a doctor, things like that. So, and then they also asked about healthcare utilization. So they got the best data, or the most data on CDSMP, less on DSMP, and then they got some on Tomondo, which they had quite a few participants in the classes, but not so many in the follow-up. In this survey, they did the survey at the end of the class, and then 6 months later, but they didn't do the 12 months later, which is part of Stanford's model. But for the confidence that people expressed in managing different symptoms, at 6 months after the class, they showed a lot of significant improvements according to the participants and how confident they felt before the class and how confident they felt 6 months after. So that's really positive. That's on that first page. On the bottom where you see the p-value of 0.001, that's a really high statistical significance level. So that was that's really good. On the next page, it talks about the change in utilization of medical resources. Unfortunately, this did not mirror the results that Stanford has gotten. And in some cases, the utilization went up. In fact, with 3 of the measures, it went up. So they reported going to the hospital more often, staying longer, or how many times they went to the hospital, how many times did they stay overnight or longer, and how many nights they spent. It's not a lot, but I'm not really sure why this would be. Sort of speculated about, it could be something about the survey itself or the methodology, or it could be that maybe the people in our classes aren't as impaired or disabled as some of the people in Stanford's research. I really don't know. It was disappointing to see that, but wanted to pass that on as that this was a result of research done by the University of Colorado, Denver, and with COA and CDPHE. So, there's always a risk that the research you do won't show the results that you want, and we hope that's not the case. But Dr. Kate Lorg, who created the program, has said in various forums that it's not just about cost savings, but of course, quality of life and improvement in health, whether it results in fewer visits to the emergency room or whatever. Also, the other thing I thought is that the incidence of hospitalization, and that seems kind of low to begin with, but I don't know because I didn't have a chance to compare that with the data that Stanford has collected. But wanted to provide that for you as one piece of information. Are there any questions or comments about that?
And this was the 2010 report is the one you're looking at?
Yes.
Is that correct? Okay.
Yes. Lindsay, since you were involved in that, was there any discussion or speculation about why the healthcare utilization data did not reflect a reduction?
Well, I think part of the problem with the whole design of it, which really, it's hard to second guess at this point, but because it's all self-reported, you're kind of going with what people remembered and what they thought. And so when we did the follow-ups, and people were much more aware of what we were asking and why we were asking. So one of the thoughts is that perhaps they were more accurate in the post-questioning than they were in the pre-questioning, so that would be a part of it. So that in the pre-questioning, they were saying what they thought we wanted them to say, which is, oh yeah, I'm not going to the hospital that often. And that then through the class, they got very much more comfortable with talking about their health and dealing with their health. And so then at the end, they were more accurate in reporting I'm in the hospital. That was one of the researchers' thoughts. But of course, you can't necessarily prove that. But that's one of the tricks with the self-reported data.
Okay. Any other comments, questions? Okay.
So,
all right.
Connie, what are you thinking about the? Are you still thinking this is something that you're hoping we will be able to take on again to do a statewide survey like this? Is that the thought?
Well, it would be ideal to have recent Colorado data statewide, both on doing exactly what Stanford did, because that's a basis for their evidence-based credential, if you will, from the federal government that it shows those results. So we could say, yes, it's not only in California or wherever those additional surveys or Stanford surveys were done, but also it's the same in Colorado. We do have the data that Susan Milligan has, but that is just one location. So yes, I think it would be ideal if we could replicate that. Then the other piece of that is looking at the actual healthcare utilization data through HCPF/Medicaid. But I don't have enough funding to pay for both. So what I did was try to carve out a small amount for to support HCPF's data analysis. We may be able to look at, getting some graduate students who need a research project to take this on, and then maybe, that would be a way of getting the survey data analyzed without cost. I don't know, but if that would be the only other thought I have on how to get that funded, if people don't want to do it on their own. But I guess the other thought I had was, could each license holder agree to do a percentage of the people who are in their classes? And then if we compiled all that, then that would be a smaller piece, but for each license holder to do, but we could get it statewide, and then probably figure out a way to get it analyzed, compiled and analyzed. Because that, with Wendy's work with the interviews that she did on sustainability, just people were really saying that they wanted that data. It's kind of curious to me that it appears that no other state has done that with healthcare claims data. As I asked our person at NCOA about that, and she wasn't aware of any. So, but again, it may not show what we're hoping it would show, but that's the nature of research. So, when I asked if people wanted to do the surveys before, I didn't get anybody raising their hand to say, yeah, let's do that. But it seems to be an important part of the sustainability. In fact, I think when I talked with Kaiser used to have their own staff trained and delivered classes, and there's no one from Kaiser on the line, is there?
No, they're operating now under COA's license, so
right.
They just wanted us to report back to them on what happens on it.
And I think one of what I recall from talking to Rebecca about that was that part of the issue was that they didn't have data that proved it would save money, and so they kind of decided it would not be as good a use of their time to have their own staff licensed and training and doing classes and all that. So, that's kind of an important piece of all this, but I do think it would be really helpful to have that survey replicated here. And I don't know, I guess I could email people and say, would you be willing to do, 10% of your participants, have 10% of them participate in the survey before the class, and 6 months after and 12 months after. That's, I don't know what you all think of that idea.
Maybe a a discussion about how we would do that, because I think we'd have to have somebody set up criteria for which 10%. Are we doing just certain classes, or is it a cross-section, and would it be something we need an IRB for, or is this something that we can just do without an IRB? And so I think there may be still some additional questions and survey design pieces we might want to look at.
Yeah, I think we'd have to do some kind of randomization of selecting the people. I wasn't thinking we'd have to do an IRB with something like this, but
yeah, I don't know. I think it depends on what all we're doing and how much contact we're planning with the participants ongoing, that kind of thing.
Did you do one for the University of Colorado study?
No. But they were getting all of the de-identified data directly from the state. So, well, is there, I'm watching the clock, and I know we have some other items to discuss. Do we want to talk more about this? Do we want to put this on hold? Do you want to send out email?
I guess I send out an email about that. It does seem like we keep raising issues and don't resolve them sometimes. So it's like if we want the data, somebody's got to do it. So that's kind of bottom line. If people don't feel like it's that important, don't want to make the effort, then that's a choice that can be made. But people ask about it, and it's a definite selling point when you have it. But yeah, I'll send out an email asking about that.
Then do you want us to put this on the agenda for next time to do an update of what the?
Sure.
Because I think if we want to do something like a certain percentage across the state or something, we would need to set up what exactly we are going to be asking people to do before we'll get buy-in. So maybe that's the next step, is to talk about what exact data we are going to ask them to collect, and is it pre, post, 6 months and 12 months, or what kind of additional data is it going to be required? So maybe that's what we need to do, is talk about that.
Well, I can send an email asking if people would be willing to participate with a certain percentage, and I don't have all the details of what it would be, but my suggestion would be we do exactly what Stanford did. So we would be exactly mirroring their survey, so we wouldn't have to reinvent the wheel, and we could compare our data with theirs, and hopefully show that we get similar results that they're getting. But I will send an email just asking people if they'd be willing to consider participating with a certain percentage of their participants. So. I guess that's it for now.
I know that you also, we've got on, let me just, because we just have a few minutes left, I will just say that we've got 15 minutes. So, or 17 minutes, I guess. Just so you know, there are training updates. We did make the change on the website so that the leader trainings are as we identify them for the classes as well, so CDSMP, DSMP, and then in the details it will tell you that what the particular program is calling their training. So that has been done on the website, and I will also tell you that centralized referral systems, we don't have a lot of new folks that have come through with referrals. However, we are still having people reference it, and we pulled for part of the sustainability questioning how many hits we'd had on the website. And overall, and this is just page hits, we've got 38,000 page hits since we went live with the site. So then you have to break it down into all sorts of bits and pieces. About 1,000 people have looked at the class listings, and about 1,600 hits on the provider page. So that's just a real nutshell of it. And I know that, Connie, you wanted to talk about the name issue, and so I want to just turn the rest of the time over so we can do that.
Okay. So you've covered the items that you had on the agenda to go over?
Yeah. That's what I did, yeah.
Okay. You know, I might kind of thank you, Lindsay. You might tie this in with some of our discussion from the in-person meeting, the sustainability planning meeting, because what I did was I took everybody's ranking from 1 to 8 on the names that they liked, 1 being the top, and then I averaged them, and there wasn't a huge spread between any of them. It was the range on almost all of them was from the low to the high, you know, from 1 to 8 or 2 to 8 or 1 to 7. So some people really liked something in the same one that somebody else, well, I'm not sure if they disliked it, but they put it at the bottom of their list. So, but it was interesting to me, and this could be good news, or I don't know, I guess it could be bad news, I don't know, but the ones that that came up toward the highest, where the highest averages were the ones that COA uses, Healthier Living and Healthier Living Colorado. So I think, you know, the reason I mentioned the in-person meeting was because we talked about, for those of you who were there, you'll remember we talked about, you know, where do we go from here, and Wendy's perspective was that we need a nonprofit organization to sort of lead the charge of running this collaborative and doing outreach to find new funding sources for all license holders, and really having a true collaborative in that respect. And COA and AHEC expressed some interest in that. I know I talked with Lindsay Blackwelder, and they're still they're interested but need some more information, and need to think about it some more and all that. And COA expressed interest as well. And then we also talked about the issue of how much it costs to maintain licenses, and would people want to continue operating independently, or would they consider operating under COA's license? Would COA want to do that? What would be the criteria? So it's kind of related, unless, since COA uses Healthier Living Colorado, if everybody else could use just Healthier Living, that would be, I guess, an option. And then it would be very, have that consistency statewide. But I guess the ones that came in next were, again, the point spread on these is not high, or not really a large point spread between the first, second, and third choice. But second was the Be Well combinations, and the third was the English version of the Spanish language classes of Take Control of Your Health or Taking Control of Your Health. But if we look at Healthier Living and Healthier Living Colorado, I guess, Lindsay, I don't know if you are prepared to answer this right now, but I think an issue is, if you can't answer now, could you give that information maybe on the next call, is, I guess, would you consider having other people operate under your license, and if so, what would be the requirements from them? And I asked you some of that in an email, but
yes, and as I sent out that information to actually everybody on the collaborative, so
okay.
Yes, we're happy to have people operate under our license, and it would be very similar to how we worked with partners before they had separate licenses, because a lot of the folks on the call were with us back in the day. So what we would do is have an MOU with you as an organization that would spell out what our job is as license holder, how we handle paperwork and fidelity and all those kind of things. And so what would then, that would give you the ability to use Healthier Living Colorado, Tamondo Control Colorado, and the other names. And then what we pick up is we would have you sending data to us, and then we send it on to the state, and then we are able to provide organization-level information back, data back, compared with other license or compared with other programs under our license. And then we do the reporting to Stanford, and we pay for the license. So it's fairly straightforward, and anything that is what we can do is also provide information on a license-by-license basis, or a license holder by license holder basis, if you have any questions or concerns about how we handle specific things. But basically what we do is what we do with every organization we work with, which is to spell it all out in an MOU, make sure everybody's comfortable. And I just want to say again, I said this in the letter, but there's no pressure intended with this. This is a if you want to, and does not mean you can't, does not mean we won't still be partners. But if you are looking for a way to streamline what you're doing and are looking for a way to not have to pay for your own license fee and do your own reporting, then this is an option.
Did you get any responses back from anybody?
Yeah, I did, from several folks. Yeah, and I think there are people that are considering it. And we've had some conversations about MOUs and things, but I think some people are looking at it as how do we do sustainability, and is this a better way to partner? And so I think that's part of it. Part of it is the name as well. A lot of people like Healthier Living Colorado and have been using it. We're using it before the ERA funding and feel comfortable with it. So, and I think that Lindsay Blackwelder also sent out information to everybody, just weighing in on the name from her perspective as well. And she was involved in the branding, the Be Well branding, as I understand it, that was used during the ERA funding. So that's my 2 cents on it.
Okay. It gets a little complicated, I think, because, well, a couple questions. What would people, if they, and this is for our discussion purposes, in my view, this is separate from what organization would sort of lead the charge, whether it's AHEC or COA. But as far as the licensing and naming, what would license holders give up if they were to become licensed under your name?
I'm not sure they would give up anything. What they would be doing is they would be operating under our license. So they would not be reporting numbers as an individual license holder. They would be sending data onto us, and then would have data that they were reporting as an organization. So in terms of if we were doing another grant that was exactly the same as this one was, the funding would pass through COA and then go to them as opposed to going directly to them. But it wouldn't change how the funding worked at all, because that's how we do it with all of the organizations we partner with now. So from our perspective, what this is because we keep a lot of the data anyway, because we do a lot of reporting anyway, this just adds to what we are already doing. So having another organization under our umbrella or working under our license actually makes our work with partnering easier, and just because we're all under the same license. But there isn't anything that I can think of that people are giving up except to be able to say they have their own license.
Would there be a cost?
No.
Would they have to pay you, or would you take?
No, there isn't a cost. because there would not be a cost. So what would happen is if we were adding other people's programs into our license, we have a license rate that right now encompasses all the classes we do and the growth we project. So then we just adjust that with Stanford based on the additional classes that would be coming under our license.
So they would not have to pay any licensing fee?
I'm sorry?
Sorry, they wouldn't have to pay a license fee?
No, no, they wouldn't be paying a license fee if they're, because COA would be paying for that.
Mm-hmm. So why would you want to do this from COA's perspective? How would that, what's the payoff for you?
Yeah, this is what we do. And from our perspective, we are, it's about making it as seamless and easy to deliver programs statewide as we can. And I think all of us under the same, having more programs under the license makes that easier for us and for the people under our license. So that's part of why we're doing it. Part of what we get out of it is the ability to report those numbers. And so that's a good thing for us. So, you know, I know that some of the license holders are reporting numbers through SAM, and they still have that ability to do that. And then we report the numbers to the state, which then goes on to the NCOA. And so, you know, so it just is a different way of presenting those numbers. It also means that we can include people in funding opportunities as they come up for us, separate from the funding that's available right now. So that if we have a contract or we have a research project or something like that we're working on, we can include people under our license more easily than we can include other license holders.
For funding?
Yes, depending on what the funding is. Yeah, I mean, it's already in place for this grant, but I'm thinking, you know, moving forward with other contracts or other grants. But it's mainly, you know, Connie, we really came to, how we came to be was that we were the nonprofit arm working with the state unit and CDPHE in delivering the classes. And so that's why it was our name on that 2010 report, because there were only a couple of license holders in the state, and we reported data for all of them through COA. And so from our perspective, from my perspective, similar to what we were doing before. So it's not a huge change. It's just kind of taking us back to what was working well before. So it's not a stretch for us.
Well, I know some people don't want to do that, but others may. And the challenge with the name still is that it's not distinct boundaries that have nothing to do with anybody else. And this sustainability effort is largely going to be, should be at a statewide level, so that all license holders or people providing classes could benefit from some connection that's made with a health plan, with Medicaid, with, you know, this, well, potentially employer groups if they're statewide. But that's the idea of the sustainability. I mean, we did the local sustainability planning where people can, you know, hopefully got some ideas about what they could do in their own communities, where they might be working with a specific hospital that's local there, or a foundation, or a specific of a sustainable program for Colorado. Is that, you know, there would be an organization championing the cause for everybody. So, and that still gets tricky. I guess if everybody else, your trademark name is Healthier Living Colorado, and
and Healthier Living Colorado Diabetes and Tumando Control Colorado. And Tumando Control Diabetes. And again,
other people,
say, I don't know how many are still on the call with us. I think we've dropped off a few people, but this is not meant to be. This is a if you want to, you are welcome, and we can talk about it. If people don't want to do this and they want to still do their own name, or they want to have a tagline that we all use, I mean that's fine. And I'm not suggesting everybody has to do this. It's an offer, and it's an offer because many of the programs doing these classes is one of the million things they do. And if it's helpful that an organization like ours that really focuses on this takes on the work of doing the reporting and paying the license fee, that's just what we do every day. So that is not a big deal, and that's really the bottom line.
Yeah, and I know we're out of time. If I could squeeze in one last question, is if it's a simple one. So if you, as COA, you market yourself very well and have a lot of connections that probably other people don't, some of which could be have impact statewide. If they were operating, for the people that are operating under your license, would you be doing that marketing for them as well?
Absolutely. Absolutely.
And they would benefit from contracts you got with somebody if it was in their geographic area, or
absolutely.
Like with
absolutely.
Medicaid, for example, that's statewide.
We work with people on a partnering basis. So if, for example, we have a project that's in the backyard of University of Colorado North, formerly known as Poudre Valley. I can't seem to forget the Poudre Valley part, but then we work with that license holder. We work with those partners across the state. But this would just, if we had people that were operating under our license, then of course they would benefit from that. But keep in mind that I agree with you, it's a separate conversation. I mean, I'm talking to you now as the Executive Director of COLA, and we've also been very supportive and will always continue to be supportive of our collaborative and working collaboratively with all the license holders. So that won't change. This is just about how certain license holders, certain organizations might want to structure what they're doing.
Okay. Well, I think I was talking to Lindsay Blackwelder, and you send out an email to people asking, for at the top level, the champion, for lack of a better word right now, who would run the collaborative and do statewide outreach and that, what kinds of things people would be expecting so that, COA and AHEC can look and see if that's something they'd be interested in doing. But I know we're out of time, so I'll just leave it at that, I guess, for now. It takes a long time to make these decisions, doesn't it?
It does. It does. And name changing that's a big deal. And so I think I'm kind of glad we're taking it really seriously because it's a lot of work and it's a lot of money, and so yeah. But yes, you're right. It takes a long time. So we'll put this on the agenda for next month too.
Sounds good. Yes.
Okay. Let me get to, so the trainings are going to be on the website, and you're going to let us know if you have any future agenda items. The next meeting is Thursday, April 2nd from 9 to 10:30, and we will get the recording up for you on selfmanagementcolorado.org. And is there any questions, comments as we're winding down? I don't think we have a lot of people still with us, Connie, but we will hope that they will listen to the recording.
I'm still here, Lindsay. It's Lucy.
Hey, Lucy.
Yeah, sorry for my hassles this morning. For some reason, I couldn't find any connection anywhere.
That's okay. I'm glad Cheryl got you the info.
Yeah, thanks. Just curious too, for those who come under your license, have you thought about? I mean, what has that relationship been in the past in terms of ongoing connections, bringing
groups together, possible offerings of trainings in different ways. I don't know. I'm just toying with what do you see that role being when you have a group of people under you, maybe beyond the basics of what the requirements are. I don't know if I'm making sense. If you've envisioned anything.
We do a lot of work with trainings and joint trainings. We do a lot of work with funding opportunities as they come up, and I hesitate to say that because sometimes there are things that are very specific. We are only funding classes where people stand on their left foot. Or how that goes.
Right.
But we do have those things that come up, and so our first thought is we go to our license, the people that work under our license first, just because it makes it easier for us.
Yeah.
It also is a way that we can work with you. For example, if you have a class that's going on the western slope, and we have a clinic that's interested in referring people. It's very similar to what we do on the collaborative, only instead of on a license holder to license holder basis, we just, we do it on a, hey, any chance you guys want to do an extra class in Montrose? Because here's what I can pay you to do it, and we have funding. So it's very similar to the kinds of conversations we have on a collaborative level, only a little different. And so, for example, if it was a funding opportunity like the current grant, rather than you sending in information to Lindsay Blackwelder and getting payment, you would just send it to us. We would issue.
I think I'm talking more about bringing people together.
I'm sorry, more about what?
As a benefit, other kinds of. I'm trying to think of examples to enhance leaders' abilities. I mean, I know it's really laid out with Stanford, but as you're in your role of going above and beyond. But I understand you do need money to do that. But I was just trying to think of what co-op.
I think what you're talking about is opportunities for not only leaders to network, but for leaders and master trainers to network, and for us to be able to hook you in with other systems that we're working with. So if, for example, we're
because that's how the system's going to be more powerful. So if we're all just entities under you, there's really no
barriers.
Ground is
there's no barriers whether perceived or real.
I think you lose potential for greater benefit, I guess is what I'm saying.
Well, I think so, because I think what we have had the opportunity to do with the organizations we work with is to also help them when they're going to partner with somebody. So if you, for example, are wanting to do classes in Durango, there's a license holder in Durango, but they don't offer classes. But we offer classes in Durango and can help introduce you to the people in the community that we work with that are at the federally qualified health center down there, as well as in the individual practices. And if specifically what you're wanting to do is to work with people who have had traumatic brain injuries, for example, then we could help hook in what CNI is doing with what, say, Access Health is doing and what the hospital is doing, so that we can kind of shortcut things a little bit.
Good, thanks.
And I'd be happy to talk with you more offline. There probably are some specific instances that you're thinking of that we could talk about. I do know that some of the things that come with it are, like, if we have to do an upgrade or an update on teaching materials or manuals or anything like that, we pay for that and handle that for all the license holders. So if, for example, if when the new curriculum comes out for Tamondo, anybody that's under our license will pay for the upgrading of the master trainers and the leaders, or updating, whatever we're calling it. Make sure everybody has the right materials and all that kind of stuff.
Thanks.
Sure. I'm feeling like I haven't gotten specific enough for you, but I'm happy to.
Yeah, no, I think it's just me. I'm just kind of in brainstorming mode here. That's okay. Yeah.
And I'm kind of wondering if we should have
we put it in writing. so that you know what we'll handle, what the expectations are, all that stuff.
Right.
There's so many of these issues, and it seems like a lot of times that what I end up doing is emailing people to get input, which works to some extent. Some people don't respond, but we do get a fair number of responses. But I'm still, as we're talking about it more, just thinking maybe we should try to do another in-person meeting, maybe May, something like that, to try to get more face-to-face input and some kind of the higher level follow-up to the meeting we had with Wendy. I don't know, maybe that might be something we should look at doing, because it is helpful. I think it's hard for people to travel, some people more than others, but we did a pretty good job. Got a lot of people there, and a couple people who were on the phone the whole time and participated as best they could. But what do you think, Lindsay?
I think that's I think that's a good idea. I think these are big issues, and maybe we start with having some conversations with you and with AHEC in terms of what they're thinking in terms of moving forward. I don't know, but I always think in-person meetings are good. The problem is the people that are outside of town will need travel assistance probably.
Well, I put in a budget for everybody to travel in, and a lot of people haven't, so I think I still have some the travel money for year 3. I better double check that before I say that. I'm not sure which pot I put it in, but I think I would be able to cover that for the people who are traveling longer distances.
Okay. Well, I hate to do this, but I have to be on another webinar. I'm hosting another one at 11, and so I need to take a little quick break and then get on the other webinar. So I am happy to, if we need to set another meeting time, or I can leave the line open if you guys want to keep going until 11, and then I'll need to take back the line. But I'm going to have to drop off at this point.
Well, I'll send out that email asking.
Yeah, I'm here. Too. Thanks a lot.
Okay.
Okay. Thanks.
I'm sorry,
so Lindsay, I don't know what input I'll get, but I could send out an email asking people, what, and maybe I'll look at that section of the report from Wendy too, and see if she has some more specifics of what she thinks that champion organization would do. Not that we have to follow that exactly, but anyway, ask people, what would your expectations be, aside from what it would cost you financially to have some organization doing this, because whether it's AHEC or COA, you're going to need some money to do this. But anyhow, ask them what their expectations would be and desires and all that, and then maybe we could, that might help with Lindsay Blackwelder and seeing if AHEC wants to continue moving forward, and if so, then we can figure out a process for deciding how to decide that, I guess.
Okay. And again, I'm sorry, but I'm going to have to drop off.
Yeah, no, I think, yeah, I do too. I've got to.
Okay. Well, then I'll stop the recording here, and